You are welcome to Vascular Dementia Part 2, Masterclass Psychiatry. I'm Dr. Prosper Tettey Doe. We'll be covering the following in this presentation. There will be a clinical case scenario, prevalence investigation, psychological assessment, and finally management. Now, the clinical scenario is after seeing and assessing the gentleman in the previous presentation, you are asked to see his wife. She is very anxious and wants to know if her husband has dementia. Her father suffered due to dementia and she had to take care of him till his last days. She was not able to get any help for her father and has very negative views about mental health services. You are required to answer her questions, explain your findings, and discuss the management plan. The task in this station is to reassure the carer and explain the symptoms and the help available in simple terms. So first and foremost, address the carer's concerns rather than educating her. Whilst giving information to the carer, tailor it to her needs and do not overload her with information, and make the interview an interaction and not a lecture. Some useful questions are here on prevalence. Vascular dementia is the second most common cause of dementia in Europe. It is the most common form in some parts of Asia. The prevalence of the illness is 1.5% in Western countries. It accounts for 20 to 40% in Europe. The incidence of dementia is 9 times higher in patients who have had a stroke than in controls. 25% of stroke patients develop new onset dementia within a year of their stroke. Prevalence of vascular dementia is higher in men than in women, and it increases with age. The next is investigation. There appears to be little general agreement about what standard tests should be done. For example, tests for thyroid function, vitamin B12 deficiency may be done routinely in some areas, but in other areas they may only be carried out if there are other indicators for these disorders. Similarly, a skull X-ray may or may not be routine. An EEG, that is electroencephalogram, shows some aspects of brain function but is of limited value in diagnosing dementia. It can sometimes be useful in identifying a brain tumor, but computerized tomography (CT) scans are better. CT scans are not routinely requested in the United Kingdom as they are very expensive and they have proved to be of limited use in diagnosing dementia. They cannot, for example, identify the characteristic changes, which are tangles and plaques of Alzheimer's, which can only be seen at post-mortem. A CT scan would usually be considered if there is suspicion of organic brain disorder in a younger person, that is up to late middle age, when causes other than Alzheimer's are more common. It may also be considered if there is indication of brain tumor in an older person, or if the dementia had an unusually rapid onset. MRI and SPECT scans both look at blood flow in the brain. A SPECT scan may help to confirm the diagnosis in some cases. Now we go on to psychological assessments, which one may refer to as a useful tool. This assessment is to investigate the individual's mental state and their thinking and reasoning abilities. The level of awareness and ability to concentrate and pay attention are also assessed. That is, fluctuating levels may indicate delirium or acute confusion. For example, the Mini Mental State Examination (MMSE) is a standard test that is often used in assessments. A low score on this test does not necessarily imply a diagnosis of dementia, but it will mean that person needs further assessment. The assessment should include sufficient investigations to enable the doctor to distinguish between possible diagnoses. However, these assessments will not subject a person who is already confused to an extensive series of unnecessary and distressing tests. An appropriate balance will need to be achieved. Now, on management. Although there are claims that the symptoms of vascular dementia can be reduced in some cases, there is no known scientifically documented way to restore the normal function of brain tissue due to stroke or TIAs. The good news is that further damage can be prevented. Medication can help improve blood circulation in the brain and reduce the probability of future strokes. There are also different therapies such as physiotherapy, occupational therapy, and speech therapy that help stimulate near normal movements and speech patterns. Other management plans focus on lifestyle modification and include day hospitals, groups, and individual therapy for mental health symptoms, structuring of the day, memory clinic, carer assessment, and help. The patient will need to think about making a will and advance directive. They also should be advised to decide about registering lasting power of attorney. When illness worsens, the family will have to think about mental health, residential home, or nursing home. The above information should be tailored according to what the carer wants to know. During the discussion, you can give leaflets and website addresses. Thank you for your attention for this presentation on vascular dementia. And if you are interested in further information on other topics in this series, then subscribe all and you will receive future information like this. Bye.